Wes Streeting, the Health Secretary, has warned that billions raised in Labour's budget tax measures won't solve the NHS crisis. He cautioned that extra funds are unlikely to significantly improve patient care or reduce waiting list deaths this winter. Labour plans to boost NHS capital spending and invest £1.5 billion in surgical hubs and radiotherapy. The aim there is to provide an additional 40,000 appointments weekly. Can that happen? Lord Norman Warner is a former Labour Health Minister. Norman, good afternoon to you, sir.
Hello.
Nice to have you with us. Look, I mean, every health secretary wants to solve the crisis. Every one of them said, look, you know, we're on it, we're going to sort it out. Mr. Streeting, I think, has been rather honest in his assessment of where we are at. But, of course, you know, patients want a bit of good news as well. Is there any out there for our health service, do you think?
Not a lot, I'm afraid. The big problem, I think, is that since Labour came to power, there has been no mention whatsoever of adult social care. Now, if you want to stop people going into hospital, particularly elderly people, and you want to get them out of hospital faster to make room for new people to come in, you do something about social care. And Labour was all for criticising the Conservatives when they were in office about the lack of a solution to social care. But all we've heard from Wes Streeting is the possibility of a Royal Commission on Social Care. And frankly, social care would do more to improve the status of the NHS if it was improved than almost anything else. And it's relatively cheap to actually boost social care compared with the NHS. Hospitals are very expensive.
I was going to say, lots of, again, I mean, we had Boris Johnson, didn't we, on the steps of Downing Street? I mean, he made that a very firm promise in his pitch, not his pitch, his opening speech when he was first given the job or first became Prime Minister, that, you know, so I will finally sort out social care. They've all talked about it. Theresa May said she was going to give it a go. Nothing seems to happen. What is it about this Gordian knot of social care, Norman, that nobody can seem to solve?
I think, well, you're a journalist, you would know, but my sense is the NHS has more firepower with journalism and the news and politicians than social care does. Poor old social care is really a Cinderella service. And what we've got now is the fact that this Cinderella service not only doesn't go to the ball, she actually gets ignored. And this is the key issue, I think. No one has ever said you can fix the NHS without fixing social care. Yeah. And because it is such a big stopper of using hospitals efficiently if you don't fix it.
There are parallels with what Wes Streeting is talking about and the administration you served under, Tony Blair. He quite openly did bring in some private investment, the independent private sector treatment centres, I think I've got that right, which were very prolific in those early days of the Blair administration. Mr. Streeting is talking about something similar. Is that the beginning of a solution?
Well, you've certainly got to do something about elective surgery as well. I mean, and he is pointing in the right direction by talking about more independent elective surgery hubs. That is the right direction to go in. But you've actually got to open up a big dialogue with the private sector about elective surgery. Because when I was a minister and we introduced these ISTCs, what we did was a longer-term deal with the private sector. So we would guarantee a supply of people. They would actually invest in new capacity and actually take the risk of filling those beds that they put up. And that kind of long-term thinking seems to me to be absent. If you want the private sector to cooperate, you've got to give them some guarantees and ensure that they play in the game for a long period of time.
So social care would be your starting point in terms of beginning this journey to unravel the labyrinthine world of the waiting list and the crisis that is currently enveloping our health system. Social
care first, elective surgery second, and public health third. And those are the three big things that we've got to do to basically do what Singapore has done, which is to stop people going into acute hospitals and then being unable to get them out back home. And that is a major, major issue. And it gets worse in the winter.
Yeah.
I mean, we should not be surprised. The NHS has been having a winter crisis for as long as I can remember. So it shouldn't surprise people that elderly people get more sick in the winter.
Yeah, true.
And make more demands on the acute hospital sector.
A lot of our listeners getting in touch talking about prevention, the P word, which we've all known forever, that of course prevention is a good thing. If you eat rubbish, you will get ill and you are susceptible to all manner of illnesses and diseases, sometimes later on in life, which is why you don't really notice that eating the bad stuff is not a good idea, because it sends you an invoice 20 years down the line. We've known this advice forever, Norman, but, you know, getting people on board with that for something you can't see, as it were, is pretty tricky, isn't it? Personal responsibility sounds good. It ain't that easy.
No one wants to be accused of a nanny state, but in fact, Keir Starmer was actually right this week when he said we do need a bit of nanny state. We do have to drive an agenda, I think, around sugar consumption, prepared meals consumption, unhealthy diets. If we don't drive that, we can't actually rely on a drug to cure the problem. We've got to get people, as you rightly say, taking more personal responsibility for their own health.
Indeed. On that point, Lord Norman Warner, thank you, sir. Always great to get your views on these things. He's a former Labour health minister. He's quite a realist.